Coming up, we'll be on location at Sollay Cosmetic Medical and Laser Center in Baltimore, Maryland, discussing the latest advances in cosmetic and aesthetic treatments, including body contouring, skin tightening, and medical weight loss, and how they can help you achieve the look and shape you desire with two of this area's top doctors, Dr. Terrence Baker and Dr. Hannah Kalele. We're at the Sollay Cosmetic Medical and Laser Center talking about some of the latest advances in treatments in cosmetic and aesthetic procedures. And we're really pleased to have both Dr. Baker and Dr. Kalele on with us, who are two of the area's top doctors. And we're going to talk about body sculpting to begin the interview. And Dr. Baker, Dr. Kalele, welcome to the Top Doctors Interviews. How are you today?
Fine, thank you.
All right. Dr. Baker, can you please begin by telling us about some of the latest advances in body contouring?
Body contouring and body sculpting is a very exciting part of health. If you think about your body as a fine piece of marble, you want to take that piece of marble and you want to create a magnificent sculpture. You want the perfect body, the body that you've always dreamed of and that you're interested. It gives you self-confidence. It gives you a sense of satisfaction by having a shape, having an appearance that you desire. And today, medicine has provided us with the technology to assist you to do that. It used to be that you would go to the gym, you would follow a prescription diet, lose some weight, work out, and those were the only tools available, essentially water, exercise, and some dieting. But today we can use modern technology such as sculpture to assist you to not only lose your weight but to sculpt your body. We can use equipment like VeloShape to also basically give you the curves you want back. Remove the dangerous curves and put the good curves that you desire back into your body. We can use equipment like Temperature to pull the package tight, that is using radio frequency to essentially give you the tone and the appearance of the skin, but also to tighten the package after you've lost 20, 30, 40, 100 pounds, to tighten up that loose skin and give you the appearance that you want. So instead of a sagging tummy, you can have a tight tummy. Used to be in the past you have to pursue expensive surgery, be out of commission, be out of work for weeks on end. But today, modern technology allows you to lose your weight, tighten up the package, get rid of the dangerous curves, and essentially look the way that you want to look.
It sounds like it's a great new option. We go to the gym, we diet, we exercise, but a lot of times we have areas on our body that just didn't lose the fat, pockets of fat. It sounds like this can target those areas and actually give you the body and shape that you desire.
That's correct. Areas like what I call a postpartum tummy. It's that little roll of fat around your lower abdomen after you deliver your baby. You struggle to get rid of it, no matter how many sit-ups you do, no matter how many times to the gym you go. There's still this just area, this bulge of fat that just doesn't want to go away after the delivery of your baby. Also, sometimes underarms. Sometimes you'll get some loose skin and some hanging fat under your arms. Sometimes you'll get love handles, what we call love handles. Everybody out there knows what I mean. And no matter what kind of exercises you do, twists and turns and squats and lats, and no matter what you do, they just don't seem to want to go away. But today we have the technology that can not only remove that fat under the skin, but then we can pull the package tight, if you will. And that's what we're here today about, talking about body sculpting, losing weight, pulling together your package, sculpting it into the body that you've always desired. And out of that comes a confidence, a sense of self-esteem that allows you to do so well in other areas of your life. It strengthens your relationship, strengthens your marriage or your relationship with a significant other. essentially gives you the confidence to go apply for that better job that you've always wanted, but just didn't have the confidence to apply for. So this technology not only is about appearance, but it's also about personal and professional satisfaction.
Yes, it goes back to that adage, if you look good, you feel good. And it applies to the rest of your life, whether it's your job, your career, your family. You just exude more confidence. You're able to feel like you can take on the world, basically. And if you could tell us, Dr. Baker, how do some of these treatments or procedures work more specifically, like the sculpture? How does it target the fat and how does it remove the fat?
Sculpture is an incredible piece of modern technology that uses laser light to target specifically fat cells in all the wrong places. Fat cells where you don't want them, around your midsection, around your underarms, your back, your upper back, your lower back, your inner thighs, outer thighs. So it's fat in all the wrong places. Fat is an essential part of the human body, but sometimes we just end up with some extra storage in places that we don't want. Some of that's genetic. It's not your fault. Sometimes it's just the genes that you got from your parents and your family, and sometimes your culture. Other times it is related to weight that you've gained, and it's stored in all the wrong places that we've talked about: thighs, back, upper back, shoulders, underarms, places where it's just not desirable and not helpful, and it takes away from your appearance, both professionally as well as personally. And so what the sculpture does is it uses a special laser light that is applied to the area of concern. You can treat 4 areas at a time, and you're essentially using light to fracture or break the fat cells. And then the body's natural immune system will come in and remove those fat cells permanently. So it's a permanent fat loss, and those fat cells are gone. Probably about 30% per session of the fat cells in the area that you're treating are destroyed permanently. We recommend that patients have 3 to 6 treatments, that they plan to have 3 to 6 treatments over time, somewhere between 3 and 4 weeks apart usually, in order to get the appearance that they want. But for some patients, 1 is all they need. If they're already 100 pounds and they just had that little roll of baby fat left over from their last pregnancy, their last delivery, sometimes a single treatment will suffice to reach the goals they have in mind. For other people that are more full-bodied, they may need that series of 4 to 6 treatments spread out over the course of 6 months in order to get the appearance that they desire.
That is very impressive. Who would you say is a good candidate for the sculpture treatment? I know that varies. You know, there's people that are obese, or there are people that just need to target a little bit of fat, but is it something that can serve everyone, or is it specific to certain types of patients?
Virtually everyone can benefit. I think the youngest patients we've had is about 12, and then the oldest patient we've had, I think, was about 93. And so our 93-year-old lady had a love of her life show up in the last chapter of her life, and she just wanted to be the best person that she could be. And so she needed a little toning up, trimming up, like we all do in certain areas. And so the youngest patient, I think, was 12, was a child that had gained some extra weight early in life, and more than they wanted, couldn't get it off by diet and exercise. And so medical therapeutic lasers using the sculpture was a great way to go to reach that child's goal. So I think 12 to 93 is the range that we've treated both men and women equally. All skin types, doesn't matter what nationality or what skin type you have, the sculpture is an appropriate treatment.
What would you say, Dr. Baker, are some of the key advantages of sculpture over the traditional options such as liposuction?
Well, the nice thing is, just this morning, for example, we did we shot a patient, Joe Boxer, who came in and served as a patient for us, and comes in, breakfast break, lunch break. You can come in during your break and be out. Virtually no side effects. It's comfortable, it's relaxing, it's effective. You can do it on a lunch hour. We have had patients in the past fly in to the airport here at BWI, come over by Uber, get their treatment done, and be home in time for dinner. And so it's affordable, it's effective, and it will help you to get that body shape and appearance that you want.
And how many sessions are typically necessary, Dr. Baker, for a patient to see significant results or the results that they're looking to get?
When we first see our patients, we do a history and physical and a consultation to put into our mind and the mind of the patient, what is the goal? What is the patient trying to achieve? And then based upon what the patient's trying to achieve, we write a prescription for sculpture, ultra shape power, VeloShape, one of our medical devices that will help them to reach the goals that they have in mind. So it's very patient specific. Each patient is unique. Each patient has a goal in mind. Each patient has a dream, a vision of what they'd like to look at and how they'd like to get there. Each patient also has a budget usually. And so what we'll do is put together a prescription, if you will, a medical therapeutic prescription designed to help that patient specifically reach their goal. And usually it doesn't involve just a single technology. It usually involves medical therapeutic lasers like sculpture, also radiofrequency like temperature, ultrasound waves like VeloShape, or the UltraShape Power. It's not unusual for our prescription for each patient to involve a number of treatment modalities that are unique and specific to the patient and to the dream, to the vision they have of what they're trying to achieve, and also the time course. For example, we've had lieutenant colonels come in who needed to get in shape, lose some weight, and tighten up for a physical fitness examination in order to, re-enlist, stay in the service. We've had enlisted men and women come in, same purpose, lose weight, trim up, look better, and most importantly, meet their re-enlistment criteria. We've had police captains and sergeants here in Baltimore City, Baltimore County, come in who also had weight goals that they needed to reach, and we helped them to reach those goals so that they could meet the necessities of staying employed in that occupation. So that's an example of somebody who comes in who professionally has goals in mind, and they have a time frame, 4 weeks, 6 weeks, whatever it is, before they get inspected and tested. They have a time frame in mind. Other patients come in with a different time frame. They want to do it over a period of 4 to 6 months. They have bigger projects. Somebody that comes in weighs 250, 300 pounds and wants to get down to 180 to 210 in that range. That's going to be over a period of time because you can only work with the human body so quickly as to achieve the desired results. And so some projects are bigger, some body sculpting projects are bigger, some weight loss projects are more demanding than others. And so again, it comes back to the prescription. Here at Sollay Medical Cosmetic Center, we are very big about writing a prescription of care that's specific to you. And we do that with our diabetic patients, our hypertensive patients, but also with our aesthetic patients.
I think that's a critical point. What really sets your practice apart from many in the region is that you really take the time with each patient. You sit down, try to understand their goals and their needs. You put together a customized treatment plan that can help them not only achieve but exceed their expectations. You guys are doing great work in the community. Dr. Baker, as far as these results go, when can patients begin to start seeing results?
Many of our patients report feeling and seeing results within the first 24 to 72 hours. Some of the procedures that we provide, patients actually call us back and say, doctor, I know it doesn't seem reasonable, but I already feel better. I'm already feeling and seeing some results. But nevertheless, they have that feeling of improvement, that sense of satisfaction. And that's also an important part of any successful treatment program. It's patient participation. Patient satisfaction is a very important part of realizing the goals, reaching the goals that you want to reach. It isn't just about dropping 20 pounds. There's a lot of ways to drop 20 pounds. Some of them are brutal and very nasty. and others are pleasant and give you a strong sense of satisfaction. Here at Sollay, we emphasize patient satisfaction. We emphasize putting together a treatment plan that meets the patient's needs. And we're also very open to modifying that plan as we go along, because sometimes the initial plan isn't quite getting the results that we want, isn't meeting the patient's needs the way we hope to, and we're totally, at the end of every appointment, totally open to adjusting the prescription, that is regulating the prescription, modifying the prescription, because that's what medicine is about. It's not just about the initial treatment plan and not about the initial prescription that you write, but it's about the ability to change the prescription. For example, if you have a sore throat and I start you on some penicillin, the first dose of penicillin I give you may or may not be the final dose that we end up. Penicillin may not even be the final antibiotic we end on. Perhaps we have to change the antibiotic if your sore throat isn't improving. Well, body sculpting and reaching your weight loss goals is a lot like treating a strep throat. Sometimes you have to adjust course. You have to adjust the prescription to meet the patient's unique needs.
And that's where having your medical background and experience is critical in understanding each patient, not only for their cosmetic and aesthetic side, but you have the medical knowledge as well, so you can put together the many treatment options that you offer. You pretty much offer facial rejuvenation, skin tightening, body contouring, weight loss, and other options all in one location. So a huge advantage of coming to Sollay is that you can customize the treatment to make sure you get the optimum results for each patient.
No, that's exactly right. And sometimes we uncover other medical conditions that need to be addressed along the way. We find new onset diabetes that the patient wasn't aware of. We find an uncontrolled high blood pressure problem that the patient wasn't aware of. We find other medical conditions that the patient didn't know that they have. And so that's one of the tremendous advantages of being in a medical office that also has a niche of supplying aesthetic procedures to patients. We like the idea of being full service. We can take care of children. I think our youngest child currently is 4. For many years we actually delivered babies and took care of newborns. But currently I think our practice goes from 4 to 112. We take care of all sorts of patients with all sorts of medical conditions. But we also have a niche of supplying necessary aesthetic procedures like body sculpting, weight loss, in order to meet patients' needs. Many of our diabetics need some weight loss, and we do it. Many of our hypertensives need some weight loss. Many of our osteoarthritis patients need some weight loss. And so weight loss and body sculpting and helping patients to be the best that they can be is an important part, I think, of every medical practice. But especially here at Sollay, it is the cornerstone of how we approach each patient.
Well, health, wellness, and your aesthetic all go hand in hand, all work together and affect the appearance and how you look. So I think this approach that you offer is a no-brainer. You're helping so many people in the community to improve their health and wellness and their appearance. You're doing great work, Dr. Baker. I'd also like to ask you, Sculpture is very effective with the results. We can see it delivers great results. They're permanent. It is also non-invasive and requires minimal time commitment. People can come in for an hour, get their treatment, and be on their way. Is Sculpture safe as well?
Yeah, Sculpture is extremely safe and tested on hundreds of thousands of patients over the last more than 5 years that I'm aware of. It's a very safe technology. It uses medical therapeutic laser light to destroy the cells. The ultra-shape power using ultrasound waves, also different manufacturer, but obtains similar results. We often use the two together. We recommend that our patients use the Sculpture using medical therapeutic light, and then also use medical therapeutic ultrasound waves to supplement the weight loss that they desire, permanent fat cell destruction. And then the VeloShape is another technology that we use to not only help reduce the weight, but to pull the package together. That is, to contour and begin shaping that package. So each of these technologies, whether it's the sculpture, whether it's the ultra shape power, whether it's the temperature, whether it's the VeloShape, they all have a common modality, a common purpose. That is for patients to achieve the weight that they desire, reduce the inches that they need to reduce in order to fit back into the clothes. Another category of patients we often see is bridal showers. The ladies are getting prepared for the most important time of their life, and the bride and the bridesmaid need to fit into the dresses that they've chosen. And so we often will have bridal parties come in for the purposes of trimming down a few pounds, tightening up in all the right places to have that shape that they want to have during the most important ceremony of their life, the wedding. And so they will come in, and we will uniquely put together a package for each one of the brides and bridesmaids and the groom and the groomsmen when they're having trouble fitting into their tuxedos and not quite looking the way that they want to look.
After hearing the information about the sculpture, I realized that it applied to me. I exercise, but I have pockets of fat around the love handles and abdomen area that just can't seem to lose the weight. So I actually tried the treatment and found it to be extremely effective. So I personally would also highly recommend utilizing the sculpture and Dr. Baker and Dr. Colelli, because the experience was amazing. The results were more than what I expected. Very impressed by the entire process. So that was very informative. I'd also like to talk about some of the latest advances in weight loss. And Dr. Colelli, you are really renowned in the region. You've helped so many patients as well. We're excited about having you on the program. Can you tell us a little bit about some of the latest advances in medical weight loss?
Yes, here at Sollay, we do offer several services, and medical weight loss is one of them. And as you know, especially this time of the year, a lot of our patients have gained a lot of weight. And when they come into the office, we do history and physical. We'll look at their history, we'll look at their medication, we'll look at their concern, and depending on what they wanted to achieve, we also have to get their labs done before we initiate any kind of prescription medical weight loss. And so once we do that, we want to make sure that their thyroid is under control, their blood pressure is under control. If it's not, we can also help them to do that. And we put them on either on HCG or amphetamine or a combination, depending on what they want to achieve. It's individualized. So when they come in, we have one-to-one conversation. We do the full physical, we do the full vital signs, and we examine them. We'll discuss options. So we customize it for each patient depending what they wanted to do. Is it do they want to lose 10 pounds? Do they want to lose 30 pounds? Do they want to do 20? So depending on what they wanted to do, depending on their health status. And we take everything into consideration, and we customize the medical weight loss based on all these criteria.
Dr. Colelli, as we know, obesity, being overweight, is currently at epidemic proportions in this country, and it's affecting the health of so many people. Can you tell us what the patient process is when someone contacts you, of what they would go through to lose that weight?
So when they come in, we actually book them for a consultation. We let them fill out the medical history. We do history and physical. We'll look at their medication. We'll look at their medical history. We'll look at their status and also what they wanted to achieve. Because depending on their health status, we can customize the medical weight loss options for them. And people have been very successful with this. Our patients are extremely happy. We've seen anywhere from 20 pounds weight loss to 45 pounds weight loss. That's a lot. And when they do that, usually they may not even have to be on blood pressure medication. That may need to be adjusted. Their cholesterol levels will go down. They feel great. They feel happy. And so we're not only treating the number, we're also treating the well-being of that person. And they tend to be very, very happy and excited about that.
That's great to hear. Now, can you tell us a little bit about some of these most effective treatment options or prescriptions, whether it's the HCG or how that works?
Yes, so the phenamine is a tablet that they can take once a day early in the morning, and it's an appetite suppressant. It's a stimulant. So again, if we have to check, make sure that their blood pressure is stable, their heart rate is stable, they don't have any heart condition, they don't have any untreated thyroid condition and things like that. Once we rule all that, we put them on the pill. We actually make them come back in a 1 week or so to make sure that they don't have any side effects and they are progressing well, and we will check them, make sure their blood pressure, their heart rate, everything is okay. They're not having side effects of palpitations, anything like that. And most of our patients do extremely well.
That's very impressive, and that's why it's so important to emphasize that when someone tries these options, they go to a medical practice like yours with Dr. Baker and yourself, who have the medical knowledge, the experience and background to properly supervise the process, because every patient's different. This way you avoid side effects and potential hazards or health issues that could arise when it's done correctly. It's very effective and the patients are seeing great results. And speaking of results, what kinds of results and what types of levels of weight can people expect to lose?
So, we've seen anywhere from 20 pounds weight loss to like 45. And depending on which medical weight loss they do, with phenamine, anywhere between 10 to 15 pounds. And of course, we also educate them how to eat properly, and how to exercise and how to hydrate well and things like that. Because at the end of the day, they're at home, they have to follow these things. So for those who follow, and that's why we actually let them come in also, because once they come in every week or so, we kind of talk about if they have any issues or anything like that, if they have any questions, things like that, and we can modify certain things and depending on what's going on with them. And they actually get really good results, anywhere between 20 up to 45 pounds.
That is significant, Dr. Colella, and the important thing here is that you hold their hand through the process. So many people have tried these fad diets, they order these Norditrax and all these things, they try all these gimmicks, and it just doesn't seem to work or be effective. But what you have here is a very effective weight loss program that's medically managed and supervised, and by holding their hand through the process, you're able to give them the support so they go from A to Z and actually achieve the weight loss, which is very impressive. Now, can you tell us a little bit about how long these results last, or how long does someone have to be on the program?
So, and most of the time, depending how many pounds that they want to lose, it could be 4 to 6 weeks. But then after that, we put them on maintenance diet, because that's very, very important. A lot of people will lose a certain amount of pound, but then they don't know how to do the maintenance phase. So they tend to gain it all back. So here at Sollay, we have a maintenance program for our patients, so that once they lose the amount of pounds that they want to lose, we'll put them on this maintenance diet program, which is very easy, easy to follow, affordable, and they can maintain they can maintain what they've lost. So it could be 4 to 6 weeks.
And I think that's a critical aspect as well, maintaining that weight loss throughout our life, changing the lifestyle, changing our nutritional habits of what we eat, exercise. You guide them through that entire process is what I'm hearing.
Yes, we do. We do. We include that in our package, because that's very, very important. We want our patients to be happy. We want them to continue to be healthy. And most of our patients actually have other health conditions too. What Dr. Baker earlier mentioned, that we finding out they are diabetic, or they have a new thyroid issue, or blood pressure issues that they don't even know that they have. So we can help them with that health conditions too.
Well, again, you guys are doing great work in the community. You've helped so many people lose weight and keep it off, offering a total health, wellness, and cosmetic solution. So not only do they lose the weight through your program, but you can also target and remove the fat in areas that normal weight loss can't lose through your sculpture and the other things that we discussed earlier. So it really can help people achieve not only the health and wellness they're looking for, but the look that they want as well.
Yes.
Dr. Kaleli, that was very informative. Losing the weight is so critical for improved health, wellness, and getting the look that we desire. Once we lose the weight, we have this skin, this loose skin that kind of just sags and affects how we kind of look. Dr. Baker, you offer some of the latest advances in skin tightening as well. So not only do you help people lose the weight, target the weight loss, but you also help them tighten the skin through some of these treatments. Can you tell us a little bit about some of the advances in skin tightening?
Yes. Skin tightening is often necessary after someone has had weight loss either from a diet or from a recent illness, and they have this extra skin. And the skin is the largest organ of the body, and it serves as the package wrapping, if you will. And so sometimes it's necessary to tighten it up. And in the past, surgical remedies was all that existed. But today, in 2020, we have many approaches using laser light, using radio frequency, using heat, using vibration and vacuum to stimulate the development of collagen. I want you to think about your favorite elastic gym pants. And after you've worn them for a while, the elastic just doesn't want to expand and contract. The elastic gets stretched out and it just loses its stretchiness. And yet they're your favorite pants. Well, you can go out and you can buy new elastic and have your seamstress, your tailor, to put it in, and you can restore it by putting in new elastic. The human body, it's not quite so simple. So you end up with this extra skin around your belly, your underarms, and your inner thighs, outer thighs, lower legs, upper back, a whole variety of places where you just end up with loose hanging skin. And it's just certainly not the way that any one of us want to look, okay? And as we get older, it tends to happen anyway as the skin thins and loses its collagen, loses its elastic. There's a certain part of this happens just from aging, but some part of it occurs at any age from weight loss and from having been stretched out. The elastic of the skin was stretched out and just doesn't have the ability to recoil anymore. And so we use medical technology like medical therapeutic lasers and radio frequency to stimulate, and also microneedling. We use it to stimulate the development of new collagen. Now, what is collagen? Collagen is the elasticity of the skin. It is underneath of the skin, and it serves as the part that gives the skin its flexibility, its durability, its stretchiness, if you will. And we can add elastic back into virtually every part of your body. We can use technology of radio frequency and lasers on the face and neck to tighten your neck and to tighten your face. For example, just even looking at my face, you wouldn't realize that just this time last year I had lots of extra skin from a natural aging process and also from losing some weight. And yet, as you look at my own face and neck today, things are reasonably tight for a physician of my age. And so in my own personal life, it's played an important role. So we can start with the face and the neck, and we can bring the package tight, restore the elasticity, restore the collagen, give your skin rejuvenation, a younger appearance. Literally take 10 years off of your appearance by pulling the skin tight and giving it a shine, a glow, an excited appearance of someone much younger. So it starts with the face and the neck, which is sort of the doorway to your body, if you will. The first thing a patient shows the world when they walk out every morning usually is their face and their neck. And so that's sort of your doorway to your body, if you will. And then next we go down to the chest and the back. We go to underarms and overarms in the upper and lower arms. Then we come down to the abdomen, both upper and lower abdomen, front and back. Love handles we talked about a little earlier can be pulled tight after weight has been lost. Inner thighs, outer thighs, lower legs, virtually there's no place that we can't use radio frequency, medical therapeutic lasers to pull the package together. And again, we have a number of modalities here, and so what we do is write the patient a unique prescription to meet their needs. And the technology we use on the face and the neck might be different than we use on the belly. For example, I might use a VeloShape technology from Candela, Syneron Candela. The manufacturer might use that on your abdomen and parts of your thighs. But on the other hand, use a temperature technology on your face and your neck. In this office, one of the things that we have is we have over 12 different manufacturers represented here. Now, the reason why is that no one single piece of equipment will meet every patient's needs. And so what we're able to do is we're able to mix and match what the advantages of one manufacturer over another. For example, today we're not talking about laser hair removal, but one of the things we're always looking at is how to do each procedure that we provide to do it the best that we can. And we're always looking for the cutting edge technology that will allow the patient to meet their needs and to do it in a way that's comfortable, a way that's affordable, a way that's practical, can be done in a reasonable amount of time, and gets the results, most importantly, gets the results that the patient wants. In this office, we pride ourselves in having mastered the use of multiple pieces of technology represented by over 12 manufacturers, over 32 procedures that we are able to do in our office. And so what we do is we're going to always write an individual prescription to meet your needs. And sometimes what we do for your face is a little different than what we do for your inner and outer thighs. Makes sense.
That's all to the patient's advantage. Coming to Sollay Cosmetic Medical and Laser Center, you have researched throughout the country, throughout the world to find the best technologies, the best treatment options, the most cutting-edge procedures to effectively treat and deliver the results that patients are really looking for. So it's not a one-size-fits-all approach. You will sit down with each patient, and this is what we found by speaking with some of your patients, take the time necessary to really understand what they need and what their goals are and to help them achieve their goals. It's a true partnership, and you offer a full range of some of the latest technologies in this office, at your practice here, which is very impressive. So you're not trying to force a patient to fit a circle into a square. You understand that every patient is different, and you have all the different treatment options under one roof to provide and take care of that patient and treat them with optimal results.
No, that's exactly right. Back in 2000, as a board-certified family physician, board-certified geriatric physician, I began to use medical therapeutic lasers to treat patients with painful conditions. Later, we added tattoo and ink removal, and then moved on to weight loss, body trimming, body sculpturing as services that our patients needed. At all times, I realized that no one manufacturer has all the answers. No one piece of equipment can treat every medical condition that a patient has. No one weight loss machine, like for example, comparing sculpture with UltraShape Power, with VeloShape. These are all three unique pieces of equipment that all have benefits to specific patients. And so what we've learned in this office to do is, again, write the specific prescription for each patient using the technology that's right for that patient. We have over 12 manufacturers to choose from. We have over 32 procedures that we've mastered and perform in addition to being family practice physicians and nurse practitioners. And we do this to the benefit of the patient. That is, the patient comes here can always rest assured that they're getting a prescription of care specifically designed for them.
That is very important, and everything that you offer is very safe and as well as being effective. Now, Dr. Baker, what types of results are your patients seeing from some of these skin tightening treatment options?
The results are just outrageous. I sometimes am shocked that for so many years in the 60s, 70s, 80s, we put patients through radical surgeries. In order to draw the skin tight, patients would get facelifts and tummy tucks and other sorts of invasive surgeries. And I'm not saying that all patients can be treated successfully with medical therapeutic lasers, radiofrequency, and skin tightening procedures that are non-invasive, but many can. In fact, I'd be so bold as to say most can get a significant result without a surgical referral. But I want you to know that also here, it's not unusual for us at times to point out to patients as part of their prescription that we can improve their situation, but they still may need a referral to a plastic surgeon. We have several plastic surgeons in the area that we refer to, and the plastic surgeons refer to us. Let's say a patient comes in with loose skin that doesn't need surgery. It's just not that severe. And so the plastic surgeon refers to us and says, you should go over and see Dr. Baker, Dr. Hanna. They've got the medical therapeutic lasers and the radiofrequency equipment to tighten up your need. You don't need surgery. On the other hand, sometimes patients come in. We've had patients come in that weighed over 400 pounds. So some of them gone towards 500 pounds. And after they lose 100 or two, they have so much extra skin that medical therapeutic lasers and radiofrequency is not the first answer. The first answer is to have some plastic surgery done to eliminate large amounts of extra skin. Then they come to us once they heal, and we'll finish tuning them up using medical therapeutic lasers and radiofrequency.
Well, surgery should always be the last resort. Not only are these treatments safe and effective, but they are also minimally invasive. They don't require any surgery. People can come in, get the treatment, go back to work, go back to their lives, and there's literally no downtime as well. And when you get surgery, you have the risks that are associated, you have downtime, you have recovery time. The whole experience of going to a hospital or a surgery center can be very daunting to many people. So again, this seems like a no-brainer. And on that note, I'd like to thank you both for joining us, being guests today. It was a very informative interview that can help so many people make informed decisions to their benefit and help them achieve the health, wellness, and the appearance that they desire. Thank you again for being guests today.
Thank you.